Nemolizumab monoclonal antibody is the topic of discussion for this video. Hello everyone, myself Dr Maddineni Srinivas, dermatologist from Bharat. Let us begin the discussion about this FDA-approved molecule, which is very important not only for the patients but also for the students who are the derma residents, because this was asked as a DNB theory question in paper 4, nemolizumab for 5 marks. This is available as Nemluvio 30 milligrams molecule, which is administered in a subcutaneous route. And why is this peacock picture kept here? Because this Nemoli in Telugu is peacock. So let us begin the discussion about this nemolizumab. As an introduction and general properties, you should know a few important points related to this molecule. Like I have told you, available with this Nemluvio trade name. This is a humanized monoclonal IgG2 antibody which is specifically targeting the interleukin 31 pathway. It is produced using a recombinant DNA technology in the Chinese hamster ovary cells. And according to the ATC classification, it is considered as other dermatological preparation which is used in dermatitis, excluding the corticosteroids. And this point is very important because steroids which are routinely used in the atopic dermatitis, if it is severe, they can produce a immunosuppression leading to the infections which can occur in the patients. Whereas this molecule is precisely not going to produce immunosuppression. Why is it not producing immunosuppression? We are going to see that in the next upcoming part. And it is FDA approved in 2024 for two important conditions, Prurigo Nodularis and the atopic dermatitis. Okay. What is the basic mechanism of action? So you should know about this interleukin 31 axis. So remember, this is a natural occurring cytokine, pro-inflammatory cytokine that acts as mainly a itch signaling molecule in the sensory neurons, and it also drives the inflammation, and also it will cause the epithelial barrier dysregulation and also tissue fibrosis. So what happens exactly when the cytokine, that is interleukin 31, which is naturally produced in atopic dermatitis and prurigo nodularis, is going to be in excess? So this is going to bind to the receptor, interleukin 31 receptor alpha, on the sensory C fibers and the inflammatory cells. So in the nerves, neurological, what is going to produce? It is going to cause intense pruritus, and it will also disrupt the sleep cycle. And coming to the immunological pathway, it is going to cause activation at the cellular level, thereby leading to tissue inflammation. It will also promote the epidermal hyperplasia, which will lead to the thick nodular lesions, and it will also upregulate the profibrotic markers. So this is going to ultimately lead to the chronic itch scratch cycle, which goes on and on and on. Whereas our molecule nemolizumab, what is this going to cause? It is a selective monoclonal blockade, which is very important, interleukin 31, whereby it is going to completely abort this downstream signaling cascade leading to the itching. So thereby it will cause resolution of the itching, and also the sleep will improve, and also the lesions will improve clinically. So this is the mechanism of action which you can write, and you can see this is the picture which is actually depicting the same thing. Allergens which are going to activate the T helper 2 cells, they are going to produce interleukin 31, which is going to bind to the interleukin 31 receptor alpha. Here our hero nemolizumab is going to bind to this receptor exactly, and it is going to block the pruritus which the allergens can produce, right? So now the same thing which it is written in the form of the words. So at the receptor level, it is going to bind to the interleukin 31 receptor alpha, which is expressed on the cutaneous sensory nerves and immune cells, and thereby it will directly disrupt this chronic itch scratch cycle. So specifically the action in the atopic dermatitis. So because of ultimately this is going to decrease the inflammatory and proliferative activity of the T cells and also macrophages. So it will modulate the disease gene expression. So as you can see in this picture, it is going to modulate the genes at the genetic level because of its action, and it will not lead to any kind of systemic immunosuppression. So this was the point which I was telling you. Unlike the steroids, this is not going to lead to the systemic immunosuppression. Okay, and also action in the prurigo nodularis. So it will modulate the fibrogenesis, it will reduce the fibrogenesis, and also it will stabilize the epidermal regulation, and also it will not produce the inflammation, it will block the neuroimmuno inflammation. Thereby it will reduce the thickness of the nodular lesions of the Prurigo Nodularis, and also it will reduce the fibrosis, and it will normalize the epidermal differentiation which are deranged in the Prurigo Nodularis patients. Coming to the indications, so it is first of all, how is it available? It is available as a pre-filled pen which is going to be filled, and it is going to be reconstituted with this powder form of lyophilized powder form of nemolizumab. And coming to the indications and specific ages, dosages, so atopic dermatitis, you can remember it is FDA approved for more than 12 years and above of atopic dermatitis patients who are having moderate to severe type of atopic dermatitis. And the initial loading dose is 60 milligrams given subcutaneously as two separate 30 mg preparations, right? And maintenance doses 30 mg once every 4 weeks, okay? And it is going to be given concomitantly along with the topical corticosteroids and also calcineurin inhibitor, that is tacrolimus and pimecrolimus. Can be safely tapered based on the clinical response, how the patient is responding of atopic dermatitis. In Prurigo Nodularis, it is given above the age of 18 years who are candidates for systemic therapy, that is there is very severe form of Prurigo Nodularis, right? And okay, there are so many trials which have been done. So these trials, Arcadia program for atopic dermatitis, you can just remember the names. If the examiner may ask you, you may answer the trial names. Coming to the safety, tolerability and immunogenicity, so any monoclonal antibody, it may produce anti-drug antibodies, that is a problem. But it was observed in the case of nemolizumab that there is no evidence of the impact because of these antibodies. There is no change in the pharmacokinetics, clinical efficacy or safety profile of this molecule. And it does not lead to broad immunosuppression, preserving the host microbial defense systems, very important point to remember. And it is going to improve the daily itch intensity, and also sleep quality is going to improve. You should also be knowing what are some adverse effects which may be seen with nemolizumab. So it is most commonly causing injection site reaction. So there could be erythema, swelling, pain, transient discomfort at the subcutaneous injection site. Patient should alternate injection sites to minimize the local tissue reactivity. So this is understandable. Common systemic adverse effect could be peripheral edema. So there could be fluid retention which could manifest as the peripheral swelling. Underlying mechanism likely related to interleukin-31 receptor expression on the lymphatic vascular endothelial cells, okay? And you should remember the molecule which is routinely used in atopic dermatitis, that is dupilumab, which is going to produce this conjunctivitis, keratitis, blepharitis. Basically eye symptoms are a very important problem with dupilumab, and this nemolizumab does not carry this adverse effect. So that is one good thing. And if you contrast with the small molecules, this is not going to produce a immunosuppression or myelosuppression. Even the Janus kinase inhibitors which are used in the severe eczema, they carry black box warnings for thrombosis, cytopenias and also importantly serious infections and malignancies, right? Nemolizumab is going to target the interleukin-31 receptor alpha, preserving the systemic immunosurveillance. Thereby, when compared to the JAK inhibitors, this nemolizumab is also not going to produce immunosuppression. Very important point to remember. And not only that, it will not also cause myelosuppression, which is also notoriously a problem with Janus kinase inhibitors. So that's why we are repeatedly monitoring the patients with CBP for observing any kind of malignancy or cytopenias. Coming to the role of this in the uremic pruritus, chronic kidney disease going to produce increased urea levels, hyperuricemia, which can produce a pruritus. This nemolizumab can also be used in these patients also, because of its the interleukin 31 is also associated in the patients of the chronic kidney disease, and so then molecule nemolizumab, it is going to be a blocker of this. So it is going to even be helpful in the patients who are having the hyperuricemia associated pruritus. The advantage of nemolizumab in renal impairment. So remember, this is not dependent on the excretion through the kidneys, unlike the molecules which are gabapentinoids, which depend upon the excretion through the kidneys. And why is it important? Because nemolizumab bypasses this, because actually it is cleared by the reticuloendothelial system. So there is no requirement of the proper kidney functioning, and already chronic kidney disease patients, CKD patients, are having the kidney failure issues. So there is a very less risk of drug accumulation, because it is going to be metabolized through the reticuloendothelial system, cleared. So there is not going to be severe somnolence, and also there is not going to be any neurotoxicity, which is very commonly encountered with the other systemic antipruritics which are used in the renal failure patients. So this is all about nemolizumab. I hope it was helpful. If so, please do the like button. Also do hype this video, and also do subscribe to the channel if you are new to this channel, and do comment. Thank you, sir, if this video really helped you. That's it in this video, students. If you have any doubts, you can ask in the comment section, and we will meet again in the next video soon. Happy learning. Bye bye.